Hi everyone, Dr. Patrick Lynch here, and I'm just going to talk a little bit about MS. Medical doctors will confirm an MS diagnosis with imaging, and they'll confirm the diagnosis by finding black lesions in the brain and or the spine. People with MS will generally have symptoms such as numbness and tingling in the extremities or other areas of the body. They might have brain fog, short-term memory loss, eye issues, hearing issues. They might have angina-like pains and or other cardiovascular issues. They might have digestive issues, urinary issues, digestive issues, and issues with mobility and pain and things like this. Really, the sky's the limit with MS in regards to symptoms. There's a doctor by the name of Dr. Al McDonald. He was a medical doctor, also had a PhD. He was an infectious disease specialist. He did studies on brain tissue taken from cadavers who had died with MS and or dementia and or Alzheimer's to look at the amyloid plaques under dark field microscopes and or phase contrast microscopes. And he had found that those amyloid plaques, which are the dark spots on the MRI scans, harbored life. Dr. Al McDonald found black lesions in the spine harbored not only spirochetes, but they can harbor other pathogens like microscopic roundworms, protozoa such as Babesia, bacteria such as Bartonella. Ladies and gentlemen, MS is caused by an infection of some kind. Not only will they have that infection in the brain or the spine, but it's likely going to be systemic. It's going to be in the vascular tissue, may also be on the nerve sheaths throughout the body. It could be in organ tissue, cartilage tissue, tendon tissue, ligament tissue, fascia tissue, muscle tissue, fatty tissue, bone tissue. It could be eye tissue, eardrum tissue. The infection could be in the sinuses, taste buds, digestive flora, and the digestive tract. Symptoms are associated with the immune system. Okay, so what does the immune system do? One of the main things that the immune system does is it helps keep bugs under control in the body. So now that we know that infections cause the immune system to respond with inflammation, we know that the common method of treatment is to reduce inflammation. So if we focus on suppressing the immune system with immune suppressants, what are we doing? We're suppressing the immune system, but we're not going after the infection. And if we don't go after the infection, then what happens? The infection grows and proliferates and starts to cover more area and starts to cause more damage. So instead of just reducing inflammation, it's better to go after the pathogen. It can be difficult to figure out what type of bug somebody has in the brain and or the spine. And so my approach is to go after all categories of pathogens. And I do this with herbs. And not only do I go after all categories of pathogens just to make sure that we are addressing everything and knocking everything back, but I created a diet to prevent from feeding these infections as well. If you don't feed the infections and you go after them, then you can get on top of it and annihilate them and get your life back. That's my approach. I've had patients who have had a diagnosis confirmed with imaging that they had MS. They had black lesions in the spine, they had black lesions in the brain. I've treated people for their infections, and they have had images of their spine and brain after treatment, and those black lesions were gone, and they were better, and they had their life back. So this is a thing. I've had patients who were nearly debilitated, who had severe memory loss. They had brain fog, short-term memory loss, difficulty swallowing, sinusitis. They couldn't sleep well. They were in a lot of pain. They had a lot of inflammation. They had severe digestive issues. They had cardiovascular issues. And after 3 months, they felt a lot better. They felt like they were out of the woods. After 6 months, they were exercising again. After 10 months, they were done. They had their life back. They can go back to living the life they normally do. They could eat what they want. They didn't need to take herbs or supplements. I tell people it's a good idea to do this and this for preventative purposes, so this doesn't happen again. But they have their life back. So MS does not have to be a life sentence. However, get it taken care of early on. As soon as you know that you have symptoms such as numbness and tingling in the extremities, chronic issues of any kind, may it be brain fog, short-term memory loss, sinusitis, dull achy pains over the area of the left chest, bloating, digestive issues, see somebody. See somebody who's along the lines of natural holistic medicine. Don't just go see a medical doctor unless you trust the medical doctor to find the cause of what's going on with you, if you want to know the cause. If you just want to manage your illness up until the day you die and eat Wendy's, McDonald's, and Taco Bell every day, then by all means, go to a medical doctor. That's who they cater to. But if you want to live, get your life back and live strong and be healthy and enjoy the great outdoors, then by all means, come see somebody like me. All right. God bless and have a great day.